The Affordable Care Act represented the most significant change to the U.S. healthcare system since the introduction of Medicare and Medicaid in the mid-1960s. We utilize a very large-scale data set that includes detailed information about every hospital admission and every emergency room visit in the state of California for a few years before and a few years after the introduction of the key provisions of the Affordable Care Act. And we think, my co-authors and I think this sort of evidence is really important in thinking about the pluses and minuses of this important policy change, because it's been a very controversial policy. And it's a policy where some people feel very strongly that it was terrible policy, and others feel very strongly that it was terrific. And we're trying to provide some evidence to help people understand where are the strengths and weaknesses of the legislation. For many, the conventional wisdom with the Affordable Care Act was that basically by giving people health insurance, they would get preventive care earlier that would allow them to get access to medicines or get access to care that could keep them out of the emergency room or the hospital, and might actually lead to reductions in utilization. And we actually find that for groups that saw differential increases in health insurance coverage, their utilization of care, both the emergency room and hospital admissions, went up. And that is consistent with this other view that some others have had, that basically demand curves slope down. When you lower the price of something, people are going to consume more of it. And when you give people health insurance, it costs them less to go to the emergency room or to get admitted to the hospital than it would if they didn't have health insurance. And so this is, and it looks like that effect dominates this, this sort of what economists refer to as the moral hazard effect. That sort of has a bigger effect than the increase in preventive care, reducing ER visits. Hospitals that served relatively many uninsured patients before the Affordable Care Act, financially they were doing much less well than their counterparts with mainly insured patients. And what the Affordable Care Act did is, for those hospitals, it basically provided coverage to many of their patients and allowed them to get higher reimbursement rates for the treatment that they would have otherwise been providing. And as a result of that, hospitals, especially government-owned and operated hospitals that treated relatively many uninsured, saw quite significant increases in their revenues. More specifically, government-owned and operated hospitals on average saw an increase of 20% in their revenues as a result of the Affordable Care Act. And it's not like they were making money hand over fist. These were hospitals that were somewhat struggling financially before the legislation, and this assisted them somewhat. Despite that improvement in their financial condition, one thing that we find that's quite interesting is that when people get coverage as a result of the Affordable Care Act, they actually become somewhat less likely to go to government-owned and operated hospitals and instead start going to private hospitals. And these private hospitals often have higher quality scores than their counterparts that are owned and operated by the government. So we see quite a significant reallocation of people who were previously uninsured from government-owned and operated hospitals to privately owned and operated hospitals. Essentially, prior to the ACA, if a person was uninsured and, let's say, poor, and they got hit by a car and taken to the emergency room, the emergency room wasn't going to say, you don't have any insurance, we're sorry, we're not going to provide any treatment to you. They did provide some treatment, and often the source of funds for that care was county governments. And so basically, by expanding Medicaid to these individuals, now the hospital was receiving money instead of from the county governments, mainly from the Medicaid program. And this expansion in coverage was financed primarily by the federal government.